Cranial bone is consisted of the parietal, ethmoid, sphenoid, temporal, occipital, and frontal. You can remember this by the pest of 6. Here's the parietal bone, the sphenoid, the temporal bone, the occipital bone, and the ethmoid.
So if we do this, see it? Her hand is on the frontal bone. Her fingers are on the coronal suture, see it? And this middle finger is pointing straight at the sagittal suture. And if you follow it all the way back, it comes back to the lambdoidal suture. And right here is the temporal bone. Right there is the squamous suture. Okay? So then we open up the skull. The parts of the occipital bone you need to know are the foramen magnum. I got to turn it over. And right here are the occipital condyles. So I have the foramen magnum and the occipital condyles. Okay? Remember, the sphenoid bone touches all the other bones. Do your fingers like this. That is the greater wings of the sphenoid. Do it this way. Greater wings of the sphenoid, lesser wings of the sphenoid, and the sella turcica. If I go forward, right here is the cristogali. The baby lays in the crib. See, laying in the crib on each side? That's the cribriform plate. Okay? That's part of the ethmoid bone. And if I turn it over, see this plate going straight up and down right there? That's a perpendicular plate.
Perpendicular plate.
If we turn it like this, we look them right in the nose. I look them right in the nose. This bone right here is the vomer. This one right here is the inferior nasal concha. This right here is the middle nasal concha. Now there's a superior nasal concha. It's way up there. You can't see it. And remember, the inferior nasal concha is a bone all by itself. Right? This is the maxilla. If I turn it over, this part of the hard palate, the anterior 2/3, is the palatine process of the mandible. If I go behind the suture back here, this is palatine bone. There's a suture that goes right across here. So this is palatine bone, and this is palatine process of the maxilla. So the temporal bone, I start at that opening. That is the external auditory meatus. If I go posterior, that's the mastoid process. If I go back to the external auditory meatus and come forward, this piece right here is the zygomatic process of the temporal bone. I can't go past that suture. If I come back to the auditory meatus and I go medial, right there is the mandibular fossa. If I come back to the auditory meatus and I go directly medial, right there is the styloid process of the temporal bone.
So the flat surface right there is the mandibular fossa?
Right there, yeah.
Oh, okay.
On a lot of the other ones, you'll see a little piece of rubber in there. I go 1, 2, 3, 4, 5. I go foramen magnum, jugular foramen, internal acoustic.
Oh, internal acoustic.
Jump over the hill, and there's my carotid canal. And there's my foraminal valley.
Okay.
Yeah, just follow around the corner.
Right, 1, 2, 3, 4, 5. This one, superior orbital fissure. So then what optic nerve goes through there? It's the optic foramen or the optic canal.
Oh.
Supraorbital notch. What's this? It's below.
The infraorbital foramen?
Infraorbital foramen. Superior orbital notch, because it's not closed all the way. In front of the zygomatic process, what bone is that? Come in front of the zygomatic process, what bone is this?
Zygomatic.
And what bone is that right there? That's the lacrimal bone. Okay, we've already done the sphenoid and the frontal, the palatine. So, and what's these bones right here? Nasal bones. Here's the maxilla.
Oh, okay.
Remember, the maxilla touches all the other facial bones. This is the mandibular condyle. Goes right into the mandibular fossa. This is the mandibular notch. This is the coronoid process. This is the mandibular ramus. This is the mental foramen, and this is the mental or the meni. So when we look at these, there's special ones you have to be able to name on the cervical.
Okay.
And that is, this is the transverse process, see it?
Right.
but it's only cervical that had the transverse foramen.
Right.
Okay?
Okay.
But it sits like this. This is C1, or the atlas.
Yeah.
This is C2, or the axis. And that thumb sticking up is the dens, or the odontoid process. Still has transverse foramen. See him?
Yes.
Still has a spinous process. This sits in there just like this.
Okay, yeah.
Then we have thoracic vertebrae. Then we have lumbar vertebrae. All of them, if I pick it up this way, this is my transverse process right here. This is my spinous process. This is the body, and this is the vertebral foramen right there. What you got to remember is the body gets bigger as I go down. See them? Remember, I have 7 cervical vertebrae. We eat breakfast at 7.
7. Okay.
We eat lunch at 12, 12 thoracic, and we separate 5 lumbar.
No, 12.
7 cervical, 12 thoracic, 5 lumbar.
Okay.
And then you have the sacrum and the coccyx. The sacrum's made out of 5 fused bones. The coccyx is made out of 4 fused bones. When we do the sternum is 1 bone fused out of 3. There's a suture right there. This is your jugular notch. This is the manubrium. This is the body, and this is the xiphoid process. Now this is cartilage in 12. So if I said name this rib, it'd be 1, 2, 3, 7. Notice they all have their own cartilage. Those are the true ribs. And then I have 8, 9, 10, 11, 12. See how they share that cartilage? So that's the false rib. And they don't touch any cartilage. These are false floating. Okay? And you have 12 on each side.